Collaborative. I am the Executive Director, and I want to welcome you to our September virtual general meeting. We have a wonderful schedule and agenda planned for you, but first I'm going to go ahead. I'm recording this and putting it on Facebook, but I'm turning it over to our fearless leader, Leanna, Chair. If you want to go ahead and take us from here.
Hello, everybody, and welcome to our September Fullerton Collaborative General Meeting. We are so pleased all of you are here. Whether you're on Zoom or watching on Facebook or YouTube, we really appreciate your participation in this meeting. It's very important for us to all get together and discuss our needs and the work we're doing in Fullerton. So we really are pleased, and we hope everybody's beginning of their school year has started great. If your programming is involved with the school districts or the colleges, we hope everybody is off to an amazing start with this school year. Definitely in a different place than we were last year at this time. I know in our breakout room, we were talking about how much our students are enjoying being back in the classrooms. And so I hope for all of your facilities or learning institutions that all of that is going amazing for you. And so on that note, we're going to get right into starting. And our discussion today is involving our next gen group. We have 4 areas of work that we do within the collaborative. That's not the only work we do, but one of them is our next gen youth empowerment group. And so today we're going to have Christian and Deborah introducing to you some speakers that we have that will be discussing what our needs are for our next gen and programming ideas and missions that we want to be working on this next year. So with that, I will turn it over to Deborah and Christian.
Thank you, Leanna. I also just wanted to put a chat out there. Actually, I opened up a Google Doc. It's a way for us to sign in. That way we can share our contact information. Doing it a little bit different this day. You could put it in the chat, or you could go to that Google Doc, and then everybody can have access to it. And I'll post that a couple of times throughout this meeting, because I know as you join, you won't be able to access previous chats. So I do want to just welcome everyone again, and I'm going to actually turn it over to Christian. If you could just share with us what you're thinking, and then we can move into our discussion around our panel.
Perfect. And Debbie, I may go ahead and just lead straight into our panel then after I briefly introduce what we're going to be doing today, if that's all right with you. Good afternoon, everyone. So good to see you. If you don't know who I am, I'm Christian Esteban. I have the pleasure of being the Executive Director of Hoya Scholars here in Fullerton. And I'm currently co-chairing, I should say, along with Bev Berryman, our Next Gen Youth Subcommittee. And Next Gen, if you don't know, it's our network of youth serving organizations around town that meets once a month. Every month, we share our own nonprofit services. We hear about our partners' services, and we have a chance to refer services to one another's corners of the community. That way, everyone can be in the know. We meet every first Tuesday of the month at 10 a.m. However, just to let everyone know, our next meeting date will not be October, but rather November. So we'll be meeting next Tuesday, November 2nd. So over the next 2 months, what are we going to be doing as a committee? We're going to be taking a couple of steps to assess our community need so we can better respond as a committee and as a collaborative to the many changing issues that are currently facing our community today. So in the meantime, over the course of the next few weeks, we'll be sending out a survey to Next Gen partners, and I see many of you here today, in the hopes of doing some resource mapping, essentially. And we're also going to be individually connecting with many of our partners to discuss how we can best make use of our collective resources as a committee. So for a brief moment, and we're going to turn it over to our panel in just a moment, but I'm going to drop something in the chat. And for a moment, I'd like to just mention to everyone to check out the Google Drive in the chat, and you'll be able to see a folder with some flyers from some of our partners from NextGen. And if some partners are here that would like to drop some flyers into this Google Drive at that time to be able to share with everyone who is here, please feel free to do so at this time. You'll see flyers from some of our partners, including Ready Set OC's Youth Employment and Training Programs, WTLC's Survivors of Human Trafficking Support Group, and we've got a few more in there too. And we're going to continue to compile these, that way we can share them, not just with our committee, but with the collaborative over the coming months. So without further ado, our program for today, we are fortunate to have 3 community leaders who are affiliated with our Next Gen subcommittee. And we're going to give about 7 to 10 minutes or so to each of the 3 partners we're going to see. I would encourage you, as you're hearing partners share, if you have questions, please drop them into the chat, and we'll also check to see if any are coming through Facebook, through the live stream. And so we're going to go ahead and get started then with our first of 3 partners today. And it looks like we have, oh, and Carl, very good to see you as well. Hi there. So we have, I believe we have Steve McLaughlin here as well, who is, of course, the superintendent of the Fullerton Joint Union High School District. So at this time, we're going to invite Steve, as well as Carl Zener. Carl, again, good to see you, to share a little bit about our background, any updates from the district, and essentially, for the 2 of you, your vision for the district in the coming months. So Steve and Carl, I'll hand it off to you.
Yeah, good afternoon, everybody. And thanks for the opportunity to be a part of this and just participate in this really important conversation. For those of you who don't know me, I'm brand new. I've been here now 8 full weeks. So just learning a whole lot about the district, the community, and really all these the great people that come together to support our kids and our families. So I had a chance to meet with a subcommittee or about a week or 2 ago at this point, and really got up to speed a little bit on the various aspects of what this group can do in helping to serve our communities. And you know, as an educational system, that is our primary goal. So I want to recognize a couple other people. We have our board president, Marilyn Bushi. She's in here somewhere. I know there's a couple pages here, so you might have to scroll around. And then we have Brenda Gonzalez, who's one of our community facilitators, here as well. So really a pretty good contingent. And then Carl Zener is our executive director of administrative services, a former principal, student. He is Mr. Fullerton through and through. So he's going to be a big part of us working together in the future as well. I've asked him to participate as a board member so that we can have a stronger voice in helping to listen, hear, seek out partnerships and resources. And he works, if you don't know, about 4 feet from me. So we see each other about 97 times a day in this, and really just appreciate the variety of people in the room. For the district this year, obviously coming through COVID, I want to say coming back from COVID, but it's not even back, it's through. And we're all dealing with it in our own ways. As a school district, really proud of all the work that's been going on from the district level and getting us back into a full in-person setting this year. Really just a Herculean effort on everybody's part to help get our doors open. And we've been very successful. Probably about 99% of our students have returned to in-person instruction, full in-person, with a very small contingent that have opted to full online. As far as overall enrollment, we're almost even, which is very good, meaning that a lot of people are coming back and feeling very confident in the high schools that they get to come back to. So really proud of that. And then our message this year is really looking at this idea of meaningful connections. We've been talking from the very beginning about how do we make sure that we're making meaningful connections with our students, our staff, and in this aspect in our community. And so really with a really targeted and thoughtful focus on reestablishing maybe some connections that may have been severed due to COVID and transition. And so really happy to be a part of this group. As we all know, there's so many needs within our community. And therefore, what a great chance in order to connect all those ideas. I've also asked Carl to be a part of this because he oversees what's called a student advisory committee, which gets us once a month in front of about 5-6 kids from each of our school campuses, the leaders. And so really to kind of, I guess, bring in that student voice as well. I know this is part of the idea of the next gen. So we'll hopefully have some students involved in this conversation, but for a direct conduit into our student leadership group, Carl is also a part of that. So really here to listen and meet a lot of people, hear what's in the offerings, and then provide any support and feedback that we can, whether that be through communication, whether that be through coordination, but ultimately getting the resources to our families. So that's the big thought from my aspect. Carl, you want to jump in and share a little bit more?
Sure. Thank you, Dr. McLaughlin. Hello, everybody. Thank you for having me here today. It's great to see so many familiar and friendly faces in the breakout room. I got to catch up with a few people that I haven't talked to in a long time. Dr. McLaughlin already mentioned, I've been in Fullerton for a long time. Beechwood Elementary, Rolling Hills, Ladera Vista, Fullerton, and taught at Fullerton, assistant principal at Sunny Hills and principal at La Habra. I was in the La Habra Collaborative for 8 years, which was a wonderful opportunity to collaborate with so many great community members. And now I really look forward to working with all of you in this role. So it's great to be here. Thank you.
Brenda, do you want to share just a little bit about your role in working with the group?
Yes, I just came on board on July 1st, so not too long ago. And I took on the role of assisting our students any way possible, especially our McKinney-Vento students, our foster youth students. Just this morning, I was there with Dr. Zener, helping him out with the reentry for a juvenile student. So, you know, we try to provide as many resources as we can. If we don't have something that the student might need immediately, we do whatever it takes to try to get that to him or his family.
Great. So I think, Christian, that's kind of the big picture for us as far as specifics. I know we're in the early stages of learning on how we're putting these pieces together, but I guess in a show of force, really happy to be a part of this group, really excited to connect with you all and mostly for what it can do to help support our families. So here to learn as much as anything in this early stages.
Yes, thank you so much to the three of you for sharing, and we certainly appreciate your approach to building those meaningful connections. And I'm sure you've had no shortage of being able to have those experiences with students and the families, and of course the faculty at each of the school campuses to see that. So if anybody does have any questions for our team from the district, please feel free to drop them into the chat. And if not, we're going to go ahead and bring our next panelist on board. And if anybody has any questions for those at the district, we'll be able to bring you all around potentially in just a little bit after we hear from our next panelists. But thank you so much to everyone for introducing your team and for being here today and meeting everyone at the collaborative. We appreciate all of your work and for you being here today. Next, we're going to go ahead and turn it over to Paige Petrus Medina. And for those of you who may not know who Paige is, she is a health educator with Partners for Wellness, which is formerly NCADDOC. As a leader in preventing substance abuse and mental illness in young people, Partners for Wellness empowers communities to take action. So through collaboration, education, and advocacy, their goal is to create healthier communities. So at this time, Paige, I think you're here, though I haven't seen your square. At this time, Paige, wonderful. We'll invite you to share with us your work with the community.
Perfect. Thank you, Christian. I'm going to share my screen. I have a short little presentation. I'm a visual person, so I like to see. Let's see, I'm going to share that. Can everybody see that okay?
Yes.
Okay, perfect. So as Christian said, I'm from Partners for Wellness. My name is Paige Petrus Medina. I'm a health educator and I'm also on our internship staff. So I'm one of the intern advisors for our program. We used to be called the National Council on Alcoholism and Drug Dependence, Orange County. Very long name. It used to be a national organization and that closed. So we were a chapter of an organization that didn't exist anymore. So this early spring 2021, we decided to change our name. Just to kind of, make it more inclusive to what we do. When we say like alcoholism and drug dependence, that kind of, limits what people think that we do, because we also do counseling and we also do our mental health and wellness program. So we just wanted to be a little bit more inclusive in our name. So basically, Partners for Wellness is a nonprofit organization that was started in 1957. We've been in Orange County since then. Our mission is to developing partnerships to create healthier communities. And that for Partners for Wellness actually stands for the 4 departments that we have, which includes our DUI department, which we have in Santa Ana and Lake Forest, which is our home office. We also have a mental wellness program, which is called Connect OC, and they serve all of Orange County. They are kind of the middlemen for transitional age youth that are going from high school to college age, connecting them to all the resources and providers in the community. We also just started our counseling program, which was July 2021, so it's super new, but we are starting that as well. And then the prevention and education department, which is where I serve as a health educator, where we do a lot of substance use prevention education. And right now, a lot of those grants are tailored to tobacco use. So my project is Tobacco Free Orange County. We are funded through the California Tobacco Control Program, which is grant funded through the state. Our mission is to advocate for tobacco-free initiatives in local Orange County communities to create a healthier tobacco-free Orange County. And our two main goals for this is to roughly reduce youth access to tobacco and flavored tobacco products, and to reduce exposure to secondhand and thirdhand smoke in public areas, such as outdoor dining establishments, parks, beaches, recreational facilities, also including parking lots of those places as well, and fairgrounds. So essentially, these are our four main objectives. We work in San Clemente and San Juan Capistrano to ban the sale of flavored tobacco products. We also work in Anaheim and Costa Mesa to pass smoke-free outdoor dining policies. Orange and Rancho Santa Margarita to pass smoke-free outdoor recreational facilities and parks. And then I work in Fullerton and Mission Viejo to pass a conditional use permit to reduce tobacco retailer density from being near youth-sensitive areas like schools and youth-serving organizations. So essentially, what can we do for you? We are a nonprofit. That means that all of our services are provided for free. We provide free educational presentations to schools, students, staff, parents, community groups. We can do it in person, kind of depending on like the safety regulations and protocols that are going on. We also offer them online through Zoom. We can do it in English and Spanish. We also have some recorded webinars as well. And just because we are called Tobacco Free Orange County, we do also have the capacity to do education for all substance use prevention education. So really, if you were like, I need a presentation really bad on prescription drug use because it's really bad at my school right now, we do have that capacity because we do have that funding and a lot of information from our previous programs. We also provide free educational materials. So if you ever want one of our PowerPoints, you don't need us to speak, but you want to present it to your health class or something like that, we can provide that. We have numerous flyers, brochures, pamphlets that cover a wide range of topics that we can get to you for free. Infographics, no smoking signage if you need it for your organization. We also have numerous volunteer opportunities for our youth and young adults and community members. Like I said before, we do have internships at Partners for Wellness. Right now, we do have a Cal State Fullerton intern that's going to be with us for the fall. We get a lot of students from UCI and Cal State Long Beach as well. We also have our advisory committee, which I'll talk about in the next slide. And then just community volunteer events for any of our community members and data collection assistance because we are policy-based. So we do collect all of the opinions and attitudes of the community so we can make sure, you know, what we're doing is what the community wants. If the community really doesn't want us to be here, then we won't be here. And then just other things, we do town halls and community forums. We provide assistance with those. So if your organization ever needs assistance with, you know, putting on a community forum or a town hall, a public like meeting, things like that, we always provide assistance with our staff and our volunteers. We also do assistance with policy implementation. If your individual organization wishes to go smoke-free, we can assist you with that. We also have a vast network of partners all across Orange County in all sectors since we have been established since 1957. So we are a great resource for partnering with any kind of person that you might need in Orange County. Our advisory committee is for peer advocates that are ages 13 to 25. And these are for people that are passionate in advocating for tobacco-free policies. They're all over Orange County. We've started this in January 2021. We started our first cohort running from January to June, and we had 12 youth and young adults complete their certificate of completion. And right now we just started our 2022 school year. So it's going to run from August to June. And we already had one general meeting and one training, which got a lot of people. So we were really excited. Essentially, we can provide letters of recommendation, community service hours, helps build their resume. We provide certificates of completion and public health advocate certificates. And it's also a great way to meet new people. There are youth all over Orange County. It's middle schoolers, high schoolers, college, and just community members. So it's really great to kind of network outside of your individual school or your own city. And we cover a lot of topics like flavored tobacco and its harm, how tobacco markets to youth, the dangers of secondhand smoke, how to community organize and its benefits, how to build your public speaking skills, and then just how mental health and tobacco correlate. And some of these pictures, this first picture, we actually met with someone from Senator Newman's office for the Youth Quest in, I want to say April. So some of our youth got to speak to someone that represents the senator about why, we need these policies in Orange County and how it's affecting them personally. And then the second picture, we were just at the Fullerton Farmers Market last Thursday, and when me and one of our volunteers came out to help as well to provide a resource table. And then this last picture is also a resource booth that we did at the National Night Out. This one is in Orange, but I was also at the Fullerton one as well. So this is for our next general meeting, which is going to be September 23rd. It's 5 to 6 p.m. All of our meetings are about an hour, and we only require an hour minimum a month. So we do one general meeting a month, and then we do optional trainings that are kind of scattered around, and then some in-person events that will be scattered around as well. We do have a lot of people from Cal State Fullerton attending. We did partner with one of the professors that does public health at Cal State Fullerton. So a lot of his students like to come and learn more about the policy aspect of our program. So they are going to be out in the community more, helping us with our in-person activities if you see them anytime soon. But essentially, that is all I have for you. I'll drop our newsletter link in the chat, as well as that flyer that was on the last slide. But other than that, if you guys have any questions, there's our email, my email, our general email, our website, and our Instagrams.
Thank you so much, Paige. If someone does have a question for Paige and for Partners for Wellness, please drop them in the chat this time. Paige, I just had a quick question for you. I know something we've been discussing implementing for Next Gen is to have be able to have a youth advisory council, which I think would be wonderful to be able to have representatives from the local schools, from the high school through the college level. With your advisory council with students, you mentioned that a few of them come from Cal State Fullerton. Have you also seen the students come from local high schools, and what have their experiences on the council been like?
Yeah, we definitely get a lot more college students than like middle school and high schoolers. We actually got a lot more middle schoolers too than high schoolers, which is surprising, but a lot of them come from Nicholas Junior High. But it's been great so far. A lot of the middle schoolers have been really active in participation. Mostly that was during the spring cohort, so everything was online. We didn't have any in-person activities. So they would attend a lot, and they actually wanted to come back to assist us with creating presentations for this next cohort, which we're excited about. It is a little more challenging getting the high schoolers involved. I think, since we're still mostly online, they're kind of getting tired of being in the online setting, and this is another extracurricular activity. So that definitely is a barrier for us. But I do believe Madison attended our last meeting, and she's here. She's the Fullerton Collaborative intern, and she's in high school. But yeah, she attended one meeting so far, I believe. But yes.
Great, that's exciting to hear. Shout out to Madison for getting so plugged in, and that's awesome. Thank you, Paige, for giving junior high and high school students and college students that outlet to be able to have a tangible way to be a part of this conversation. So thank you for being here today, Paige.
Yeah, thank you.
Lastly, we're going to go ahead and turn it over to Bev Berryman, who's one of our board members and who many of you know. comes to us from Crittenton. Bev Berryman is the Community Engagement Director for Crittenton Services for Children and Families. And Crittenton, of course, is a child advocacy and mental health organization committed to believing in the potential of every child, youth, and family they serve. Since 1966, Crittenton's mission has been one of providing solutions that help empower, build resiliency, and heal the wounds of childhood trauma. So at this time, Bev, we'll invite you to share with us your work in the community.
Thanks, Christian. I really appreciate that. I'm going to add the fact that we have been in Fullerton for a little over 50 years, but in reality, Crittenton has been around for over 100 years. And that's what people don't know, is that Charles Crittenton started the night missions for women back in the 1800s, serving youth and serving moms and babies. So we have been doing things for a very long time. We're one of the only ones still in existence today. There is a national Crittenton organization that we belong to, but every one of them operates their own nonprofit independently. So that's just a little bit about the history. Not very many nonprofits are still around after 100 years, still serving, or their mission being pretty much the same as it's been. And we are at a point now at Crittenton where we're taking a look at our mission, and we have a new CEO really looking at the strategy and what we are there for, and fine-tuning some things. So as we go through the next year, I think we will be tweaking and pivoting just like everybody else is. Our intention is obviously to still serve youth. And what I would like to do is just share some of the things that we do, which is a little surprising to people, not knowing the breadth of what Crittenton does. So we serve 4 counties, Orange County being one of the counties, LA, Riverside, and San Bernardino. So we're in all those counties and we do different things. One of the things that we do is we're community-based services, where we send in a team of experts whenever there's a sign of abuse or neglect in the home, and Child Protective Services or a governmental agency gets involved and needs to provide services for that family. Our whole intention at Crittenton is to keep kids with their families, and if they're not with their families, to reunite them with their families as fast as we can, to be able to provide those supports and those services to the kids that we serve. So by providing intensive services to families, to be able to do that is one of the things that we do. We also are contracted out with different school districts to provide school-based programs, again, in the mental health arena, providing counseling services and those types of services to families and to children who need that. In addition to that, we operate a shelter here in Fullerton, where we care for youth. In addition to that, we have, which is surprising to people, is we have a transitional age program, a transitional housing program. We have a new contract here in Orange County that we've had for a few months that we're just starting to ramp up, where we take care of individuals who have aged out of the foster care system, who are 18 to 24-year-olds, and we walk alongside them to help provide services to help them adults, right? We all know, and a lot of us here might have, kids that are over 18 or be involved with kids that are, in the high school ages. Once kids turn 18 or once youth turn 18, they're not ready to really move out on their own. They're not ready to conquer life on their own. And as a foster youth, they have been, someone's been there to walk alongside them. And now all of a sudden, when youth turn 18, they sometimes don't have those same structures in place and the same support systems. So Crittenton has a transitional housing department that walks alongside them. That's one of our biggest services this year that is building. We're adding more and more apartments to our mix to help youth. I want to call them kids, but obviously they're not kids, to help youth adults and to help them become adults. So we help them with apartments, with roommates. We walk alongside them to give them the skills or help them provide, get the tools to get jobs, to go into college, to get volunteer work, to to just really help them learn how to navigate the system. In addition to that, this year, what we're doing is we're providing and looking for mentors to help us do that. Because we now have an Orange County program, it's easier for us to find mentors just because our corporate office is here in Fullerton, and all of our volunteers have been based in the Orange County area. So as we're working on a mentor program and a tutor program for those young adults, it's easy to kind of build on what we have here started and then move it out to the other counties as we go along. So one of the biggest things that we'll be asking for is to find out if people are interested in, working with 18 to 24-year-olds, because that's kind of a hard age to get people to step up for. Foster youth, right now, we have always had a foster care department, and we're always looking for foster families and resource families. We are one of the only agencies that is licensed to help refugees and unaccompanied refugees. So as you look at what's happening in Afghanistan right now, and we all know that at some point, some of those individuals that are fleeing their country because of what's going on are going to be under the age of 18 and are going to not have a family with them. So as those refugee minors come to our country, we are one of the only licensed facilities that can shelter them and place them in foster care or resource families. So there is a big push right now in obtaining resource families and starting to recruit and train people to help us with those unaccompanied minors as those refugee minors come along. So that's one of the other biggest things that's happening right now in our world. We're also looking for people to donate and to volunteer. As we get refugees in, they're going to come in with their own issues and trauma in different languages and different cultures. And it's great to be able to reach out to our community to find out, who here also has, knowledge of the culture and the language, and to bring them on board for volunteering. So if someone doesn't want to provide a home or a foster family, we will be looking for volunteers to be helping with that as well. As a partner in Next Gen, we also have youth that we serve that take advantage of all the Next Gen services. So when I am working as a committee member there, we collaborate with the high school, we collaborate with Hoya Scholars, we are collaborating with everyone that we're working with to try and bring in services to help our own clients move on, whether they're under 18 or over 18. That's what we're here to do too. So that's just a little bit about Crittenton. I think you guys, you know we're here. We know we've got services, and we pivot and we morph based on what's happening. What our services were last year are a little bit different this year, just because things change in the state of California, and every time things change in mental health, we have to move and change as well. So be more than happy to answer questions as well.
Thank you so much, Bev. As always, let me know, anybody, if you have a question for Bev right now. It sounds like the involvement for community members is to become everything from becoming a mentor to an emerging adult between 18 and 24, all the way to there's this big need for finding resource families for youth and for emerging adults as well. Bev, I'm not sure, because I know this program is new, but just piqued my curiosity. What does becoming a mentor look like, particularly for emerging adults in that age range?
Thank you. So we provide training. So it would be a requirement of going through our trauma training, basic training on how to deal with youth that have been through trauma. And it's just pretty much walking alongside them. It's teaching them how to possibly apply for a job, how to interview, maybe having lunch, maybe calling them for their birthdays. Because again, the youth that we serve in most cases don't have family here, don't have family that they can rely on. If they do have family, the family might be dysfunctional. There's a reason why they're with us and not living with their families. So they could be dysfunctional. It could be youth that don't have family members here at all. And so you are pretty much helping them gain the skills that they need to adults. So things that we take for granted on, this is how you grocery shop. This is how you can, use a coupon to be able to make your money last. This is how you dress for an interview. This is how you navigate the community college computer system, things like that we think is an easy thing to do. But for people that are coming in that could be English as a second language, it's harder for them.
So I have a follow-up question to actually go back to Steve. We've heard about wonderful organizations here, and I'm looking at, we have over 46 partners, a lot of them serving youth. What is the best way for them to reach out to the school district and to engage the leaders at the school district and also the youth through the school district, both at the high school and then also the elementary? What's the best way? For Steve, yeah, go ahead and unmute yourself.
We just serve the high school district, so the high school students. I'm going to deputize Carl Zener. He's going to be our point of contact. And then from there, we can help to make connections. And I think that's the big thing is, instead of getting a whole list, it'd be really good if there is a level of interest. And then Brenda is obviously a point of contact as well, as far as coordinating with our community service pieces. So I think it's just a matter of understanding where that support can be, where those connections can happen, and then we'll do a quick turnaround. But I just for now, so that we can then, if we're going in to talk with principals, we have weekly principal meetings. If we want to coordinate through our community liaisons, whether that's through the district or somewhere through a site or a specific site, we can help navigate that.
Excellent, thank you.
And this is Helene Morris on behalf of the Fullerton School District. Obviously, Bev Berryman is on our board, so we have our school board, so we have a wonderful connection with her as well. But I think one of the key ways is working with our social services assistants and community liaisons. And I know that position also exists at the high school district, but we have liaisons at our Title I schools, and also support for all of our schools in our district that help to connect our families to resources, that help to connect our students to resources. So that's just some support layer that we have in place, I think, that could add to the conversation.
Great, thank you so much, Lean.
If I could also add, this is Trang Lai. I also work in Fullerton School District. Another avenue to connect with our school district is through Project Connect. And if you can contact myself, you can contact Helene, and we connect with our Assistant Superintendent of Educational Services who oversees Project Connect. And the goal of Project Connect is to connect our community partners with our schools directly.
Excellent information to have. Thank you so much to everyone who shared, and that was Project Connect, correct, Trang?
Yes, Project Connect.
Great, thank you so much for sharing that. Well, at this time, I want to thank all of our panelists, Dr. McLaughlin, Dr. Zener, Brenda, Paige, Bev. Thank you for being here today. Honestly, thanks for helping all corners of the community not need to reinvent the wheel, essentially, which is what we just touched on with something like Project Connect. Two things to keep an eye out for with Next Gen. Number one, next time we're going to get together is going to be Tuesday, November 2nd. I'll drop that date into the chat. It's going to be over Zoom. Generally, that's going to be our partners coming together and each of us going around sharing for a couple of minutes what's going on at each of our organizations. It's a great time to be intentional about sharing and hearing about resources in our community, and also keep an eye out for that resource mapping survey that we're going to be able to send out. That way we can create our own collaborative resource mapping and be able to share that with everyone who is here. But thanks again to all the schools and all the organizations who make this possible. So at this time, I'll turn it over to Bev if there's anything you'd like to add. If not, we'll hand it back to Leanna.
No, you are as thorough as can be, Christian. Thank you.
Thank you both for taking on this role. And I just want to also just quickly add, we are having a discussion about how do we involve the youth in our committees, especially when our committees meet in the morning when they're at school. So we're trying to think about ways that we could maybe have an advisory council, if there's a town hall meeting, or somehow involving the youth and having a voice in our city around issues that they find that they want to discuss and just share. So we want to provide that that as a platform as well. And if you are interested, I invite you to come and join. There are, like I said, 46 people here, members. Please come to the Next Gen meeting and be able to connect with one another. I wish we had a time to have all 46 of you present we did today, but I do want you to know that we love you and we appreciate you for being a part of the collaborative. Leanna.
Thank you so much, Debbie. Yes, fantastic, everybody. I get very passionate. I'm part of the Next Gen board, so I love seeing all the work keep moving and pushing ahead, and excited to see what support we can give all of our youth and emerging adults in the next year. On that note, I am going to turn it over to Mr. Barry Ross, who is our amazing COVID update. You do such a good job. I know you help me understand especially what's going on in our home of Fullerton too, and how that's affecting us. So I will turn that over to you, Barry. Thank you.
Thank you, Leanna. And I'm just going to give a few statistics and some updates. So in Fullerton, there's two numbers we look at: the case rate per 100,000 of COVID and the positive percentage. So the week of September 7th, the case rate per 100,000 was 15.3. So for Orange County as a whole, it was 16. So that's good. But a month ago, it was 10.4. So you've seen the case rate is going up. However, some positive news is that the percent of people who test positive is going down. So in the week of September 7th, it was 5.4%. That is the same as Orange County as a whole. And the week of August 10th, it was 8.3%. So that's good news. Less people are testing positive, but our case rate is higher. Now, it varies by zip code. And just to give you an idea, the case rate in zip code 92833 is 11.26, but in 92831 is 23.26. So there is some variability by zip code. I don't think that's major significance because it sounds like it's a lot, but our case rates were in the hundreds when we had the biggest surge. So this little difference isn't tremendous. Now, I want to talk a little bit about vaccinations. And this is for Orange County. We don't have a lot of data. We have some data for Fullerton. But overall in Orange County, what we're seeing is 1.9 million people have been fully vaccinated. What's interesting is last week, there were a little over 3,000 people in Orange County vaccinated. In mid-April, there were 42,000 a week. So you can see how much the numbers of people vaccinated has gone down. And the percent that have had at least one dose varies by race and ethnicity. So 2/3 of the Asian Pacific Islander population in Orange County have had one dose, but only 35% of the Latinos under 65. So just to give you an idea, there's still disparities there. Also disparities by age. So 36% of 12 to 17-year-olds remain unvaccinated, whereas it's 14% for people 65 and over. We're seeing also high rates of unvaccination from the 18 to 24-year-olds and the 25 to 34-year-olds. So there's a lot of work to be done. Similarly, in Fullerton, there's variance by zip code as well and by race. So for example, for the under 65 population in zip code 92832, about not quite 60% have at least one dose, but only 37% of Hispanics in that zip code. So and that's pretty, that difference is the same in most of the zip codes. So if you look at who's getting COVID in Orange County, it's people that are not fully vaccinated. So I talked about the case rate, overall in Orange County was 15, but for fully vaccinated people, it's 7 per 100,000, but for not fully vaccinated people, it's 43 per 100,000. So if you're not vaccinated, you're 6 times more likely to get COVID. And finally, I just want to share at the hospital, we've seen our numbers go up and down at St. Jude. We had today 37 COVID patients, which is down from last week, which is 45 that we had on an average. But the week before, we had a day with 35. So it's kind of been between the mid 30s to the mid 40s in the last couple of weeks. About a month ago, we were at 65. So that's good that we're not seeing increased rates. And back in January, we were 240 COVID patients in the hospital. So we're clearly not where we were in the main surge, but we still have people that are very, very sick in the hospital. And finally, what are some of the issues happening right now around COVID? Well, healthcare workers are required by the state to have vaccinations by September 30th. Those staff at our hospital that don't have vaccinations by then won't be able to work, which is a big concern because we still have staff that don't want vaccinations. Workers in schools have to be vaccinated or be tested weekly. There's a lot of discussion about boosters. There still hasn't been a final approval by the FDA and CDC. They're talking about an approval possibly next week, but just to be aware that people that will be getting boosters first will be those who had vaccines at least 8 months ago. And at that time, the population that was getting vaccines were healthcare workers, and people in nursing homes, patients in nursing homes and assisted living. So it won't be open probably for the general population right away. They'll say everybody can get it based on the 8-month criteria is what they're thinking. That may change. But you may also have heard about third doses. So the CDC did recommend that people with certain immunocompromised conditions could get a third dose. That's not a booster. It's just because they don't generate enough antibodies after 2 doses. And finally, with children's vaccines, there's been a projection that for children 5 to 12, we might see Pfizer being approved by the end of October, but it's still up in the air. They want to make sure it is safe for children. So that's my update, and I'd be glad to answer any questions.
Does anybody have any questions for Barry? Well, if you think of them later, go ahead and add them to the chat, and then we could go back to those, no problem at all. Okay, next we have Trang La from Fullerton School District with an update for our Early Childhood Subcommittee.
Right. Hello, everyone. Thank you so much, all the presenters. I've really learned, every time I hear from all of you, I learned so much. So I appreciate everyone sharing today. So you may be wondering right now, did she say Early Childhood Subcommittee? Because in the past, when you've seen me present, it has been the Education Subcommittee. So yes, we've had a change of name. And the reason why we did that is that the Early Childhood Subcommittee better reflects the work that we are doing. Earlier, I spoke to you about Project Connect. Project Connect is to connect our community with our elementary to middle schools. And we saw that there was a need to focus on early childhood. And so we are now the Early Childhood Subcommittee, and applause is welcome. Thank you. Very exciting to have this change. Okay, so the last time that we met, we spoke about our mission and vision. We had a purpose statement, but the purpose statement was very long and it was very drawn out. And so we brainstormed about possible mission and vision statements. So we took all that down, and next time that we meet, we're going to finalize our vision and mission statement. And the next time that I speak to you, hopefully I can share that with you. We're very excited about this move forward. We also at the last meeting reviewed and modified our goals. As I spoke to you earlier, we had 3 areas that we are focusing on: resilient families, the quality early childhood education, and the third one is health development. It's been very exciting. The group has representation from our community health partners, including St. Jude. We are also working with Help Me Grow. We have We also have on our committee folks from Fullerton College. So we're very excited to be moving forward with this. And one of the things that we talked about when we were looking at those goals is that, you know, traditionally, when we want to outreach to our families, we think of doing a presentation. In this time, and I think we learned a lot during COVID, we can do Zoom. That's one way that we could do presentations. We could do in-person live presentations, but no matter what, I think historically, all of us know when we try to reach out to the community and we do presentations, it's very hard to reach everyone. And usually the folks that need it the most, we're not reaching out to. And so Barry was the one, I'll call out Barry. Barry who said, you know what, is there another way that we can reach out to our community? How do we make sure that this message is getting out to everyone? So I'm just posing that as a question to all of you, to all of us, to think about how we can communicate with our families. We did speak about social media. We spoke about recordings, because maybe in this time and age, we need to think about how can we make it available, easily available and accessible to our families. So maybe having it recorded if we do a presentation might be a way. So just something for all of us to think about. And then so we did revise some of our goals, and we are looking forward to breaking up into smaller groups to talk about action steps. I invite all of you to join us. Our next meeting is in November, and if you send me a message in chat, I'll be happy to add you to the list, and I'll give you all the links that you need to join us. Thank you so much.
Thank you so much, Trang. Next, we're going to jump to our health and wellness update with Tracy Breyers from St. Jude Medical Center and Peter Hernandez.
And I'm going to let Peter go ahead and present.
Okay, great. Debbie, could I please be able to screen share? Kind of to begin, as you all may recall, at the beginning of June, on behalf of St. Jude Medical Center and all of our partners, the Fullerton Collaborative, the school districts, we launched our Summer Steps Challenge. And so today I just wanted to kind of just provide a quick summary on how the Summer Steps Challenge went, and just provide some more information on our next campaign challenge that began in the beginning of September. So I'm gonna go ahead and screen share. So what you see on the screen right now is the numbers for the Summer Steps Challenge. If you all see, we had a total of 289 participants participate in the Summer Steps Challenge, who collectively completed a total amount of a little over 47 million steps. And to put it in perspective, what's really cool about that is we actually did the math to measure exactly what 47 million steps looks like. And it's actually the total of going from the West Coast of the United States to the East Coast 3 times, and you still have 500 miles to spare. So with that, I do want to congratulate everyone who participated in the Summer Steps Challenge. All of you were part of history, right? Part of Northern Orange County history, and in walking such a large amount of steps. If we look at it broken down a little bit more in detail for the city of Fullerton, what's really cool about that is that Fullerton actually gets bragging rights because of the 4 cities that we focus our Move More Healthy in. The city of Fullerton actually had the most participants, and they also completed the most steps. So we had 69 participants from the city of Fullerton who completed a little over 10 million steps. Our top stepper for the month of August, I just pulled up the screen, the Walker Tracker home screen for the city of Fullerton. And what you see on my screen right now is the list of different individuals who participated in the Summer Steps Challenge. And so as you all probably recall, I know I mentioned it back at the beginning of June, but for our top stepper for each month, we were giving out different prizes. And so for the month of August, one of our resident leaders from the city of Fullerton, Karime Calixto, completed a total of 564,000 steps, a little over that. And she actually ended up being the winner and top stepper for the month of August. And she ended up winning a Amazon Fitband, which is very similar to a Fitbit. It tracks your oxygen levels, your stress levels, your sleep patterns, and so on and so forth. With that, I did want to move on to our next challenge, which is our Fall into Fitness campaign. So continuing with the momentum that we've built with the Summer Steps Challenge, our goal is to, with the beginning of fall, what is launching our Fall into Fitness Challenge, where we're continuing to emphasize physical activity. And so we, on behalf of Move More Eat Healthy and the subcommittee and all of our partners, we will be participating in different community events within the city and just continuing to promote physical activity with adult and youth. And so one way that we're trying to promote this is by asking residents of the city to promise and commit to engage in more physical activity. And so for youth, we're asking them to commit to engage in 60 minutes of physical activity a day. And for adults, we're asking 30 minutes 5 times a week. So for a total of minimum 150 minutes for that week. As far as the timeline for this challenge, we will be running this challenge from which we just launched at the beginning of September until the end of November. And we've actually put together a monthly calendar of different daily challenges that the residents can participate in, which they could include and integrate as part of those minutes for them to complete on a daily basis. And if you don't follow Move More Eat Healthy yet on Facebook or Instagram, I will be sharing the links in the chat box, just so all of you could follow us and just look at the different resources and information that we post with the subcommittee. And again, we are doing another challenge. The challenge for the Fall into Fitness, besides just completing the physical activity aspect of it, is whichever city that ends up making the most commitments will get those bragging rights, like the Summer Steps Challenge. Right now, the city of Fullerton is on top. And so hopefully we can continue that with the Fall into Fitness campaign as well. So with that, does anyone have any questions?
No questions. They're loving the challenges. So we encourage them all to come and join us. I do want to also just do a reminder, if you're interested in joining our subcommittee, we can talk more about how we can incorporate your work and also with the community that you serve. That'll be, next meeting will be on September the 22nd. It is at 9 a.m., a different time. So be on the lookout, email me if you would like to be on that list of participants for the upcoming meeting. Once again, that's on the 22nd at 9 o'clock. Thank you, Peter.
Okay, and for our subcommittees, last but not least, we have Mr. Jason Phillips from Fullerton Act presenting information on our homelessness subcommittee.
Sorry, I'm late, and I don't have much to share other than, hey, Carl, it's good to see you. I don't know why you're here, but that's fun. So homelessness, we have hired our 2 city case managers. It's just a matter of capacity for me of getting things on the calendar. But I have kind of finished with a couple of things. So next month, the hope is to have kind of our first subcommittee meeting with the city so we can start to see where our city's going and then start to figure out what we are going to gather around and commit to as a subcommittee together. So I will be sending out that information hopefully at last week of September is my goal to kick off something in October.
Great, Jason.
Sounds great. Thank you, Jason.
And if people are interested, just send you an email or. Okay.
Yeah, if you're not already on the list, you weren't getting our subcommittee emails before, please send me an email. I'll put my email in the chat real quick to say, put me on the list, let me know what's going on.
And we'll put it into the Google Doc that we have for sign-in. Thanks, Jason.
Well, Debbie, I think we wrapped up everything literally at 3:30.
That's fabulous. So just a quick little shout out. I'm seeing people with announcements. Remind everyone to put the announcements into the chat. There are some great events. We do have an Assembly Member Quicksilva community conversation on the 2nd October. That information is in the chat. 10 a.m. So email Eddie if you're interested. We also want to invite people to the Assistance League having their membership open house on September the 16th at 10 o'clock. That information will be in also our updated email, but it's Continental Breakfast. So Marilyn, thank you for putting that in the chat as well. I'm seeing Jennifer posted us some great information from the Cal Optima for September, and that's a great calendar to keep connected with their wonderful work. Christian mentioned about Hoya Scholars and having their academy meeting every Monday at the Maple Elementary School, along with a wonderful flyer about their upcoming events as well. And then Lisa mentioned that the North Orange County Community College District approved a vaccine mandate and bringing the clinic to Fullerton College. And so that link is provided in the chat. And gosh, there's so many great, wonderful things. Elizabeth shared the CCPA flyer with that information about their work. Let's see, is there any? The Hopper Goes to College is coming up, the breast reconstruction, the Green Foundation. So please, oh yeah, Tara's Chance has a Writing with the Stars on October 2nd. Wonderful work that they're doing in the city of Fullerton as well. So make sure to check out the chat, and also the What's Happening Fullerton will be coming in your inbox. Look for that this week for information. And if you have more flyers, send that out. Oh, trunk or treats coming around the corner. We have October events coming too as well. So that's all I have, Leanna.
Do we have our date for our next meeting? I think you have it here on the agenda, Monday, October 11th at 2:30. So if you'd like to join us next month, please invite somebody to join us. We'd love to have more of our community partners or just community residents learning about the work we're doing, especially if they're looking for ways to either mentor or volunteer. This is a great way to have a personal connection first with an organization before you step out and make that commitment to mentor or volunteer. So we please ask you to invite people to attend our next meeting, which again will be on Monday, October 11th, 2 o'clock for networking and 2:30 for the meeting.
Yes, and we have over 44 members now. So welcome all the members. And if you want to join the collaborative, I just want to do a quick shout out. Email me and I'll send you that information. And then finally, if you haven't already signed into the meeting, please do so. And also check out who's attended. We appreciate you coming and joining us. Leanna.
Thank you so much, everybody. I hope you have an amazing week and we look forward to seeing you next month, if not sooner.
Bye, everyone. Thanks, Leanna.
Thank you.
Bye, everyone. Thank you.